Hello, my wonderful Parkinson patients and caregivers, and welcome to Parkinson Power. This is a program that I believe in very much. It's empowerment, it's motivation, and what I try to do is share with you all of the effective ways that you can take ownership in your life and winning ways that you can do what I call live well with Parkinson's disease. Now, you all know that Parkinson's disease is what we call chronic, progressive, degenerative, and many times you live with it for a very long time. After being in healthcare for about 45 years now, I've come to realize that most often you cannot control what happens to you. None of you can control the fact that you've been diagnosed with Parkinson's disease. But you do have the power within inside of you to control your thinking and how you choose to respond to it. How you choose to respond to it. I often say that the timing is always terrible. Most likely it affects wonderful seniors when you should be retired and life should be getting a lot easier for you. The same thing for caregivers that are now needing to step forward and to walk step by step and hand in hand with someone that they love. In other words, to help them get through the day, to be happy and effective and to be independent. Now, Parkinson's disease can affect you in all different ways, can it? I often think it really affects every part of the human being. I break it down to 4 different areas. It affects you physically, it affects you emotionally, it affects you mentally, and affects you socially. Am I right about that? Think about it. How has your diagnosis changed your life? And how has it impacted those different areas of your life? Now, we all know that Parkinson's disease affects you physically. What does it do to you physically? What does it do to you physically? We know that you have your tremor. We know that you have some rigidity. We know that you have some postural instability. And we know that you have some gait changes. And they're just the basic things that have a huge impact of what you are able to do functionally, as a mature adult. The topic today that we're going to be talking about is how to give up what you have lost and hold on to what you have. Give up what you've lost and hold on to what you have. So we're going to break that down to the 4 different ways that Parkinson's can affect you. Physically, mentally, emotionally, and socially. Now, physically, it becomes very difficult because, when you're functionally independent, you're able to do anything. You can do the things you love to do. You can jump in the car and take off. You can dress yourself, feed yourself, do your hobbies, do your activities, and do your part, however that might be defined in your relationship, whether it be your marriage or your friendship or anything else. Now, with Parkinson's disease, it affects, your dexterity, your strength, your balance, and many times, whereas you've been functionally independent for so many years, now all of a sudden, you're in need to call for help. The days of being independent, the days of walking independently and buttoning the buttons and tying the shoes, sometimes we lose that ability because Parkinson's disease affects your muscles. And your muscles can be tired, your muscles can be rigid, your muscles can be weak. And that means that you have to give up some of the things that you love to do. And we hate that, don't we? We hate that. I love to do this, I love to do that, I want to do it, and thanks to my Parkinson's disease, maybe I can't do it anymore. So my suggestion with this aspect is, certain things that you can't do anymore because of the limitations of the functional limits. I don't say you're disabled, you're not disabled, but you might have some functional limits. So some of the things that you could do before you got the disease, you can't do anymore. So you've got to let them go. You've got to let them go. And you have to figure on, what can I do? What can I do? Maybe I can't clean the garage, or maybe I can't do heavy yard work, but maybe I can do a hobby that I can do sitting down. Maybe I can take a look at doing handiwork, or listening to music, or studying, or certain things that I can do within the scope of my functional limits. It's very important that you maintain the attitude that you are independent, you are capable, and that you will find something to do to keep you on the highest functional level. Right? I want you to dress yourself. I want you to feed yourself. I want you to continue to do your cooking. I want you to continue to do everything that you are able to do within the parameters of your functional limits. Right? It's been proven that the more you do for yourself, the more under control that you feel. And normal, healthy adults, we like to do for ourselves. We like to feel independent. We like to feel capable. So if certain things that you were able to do before, you're not able to do today, then you just let them go and you focus on what can I do for myself and for my family and for my entertainment and activity as I see myself today. Right? You have no excuse, to sit in the recliner and just give up. You have no excuse not to contribute the most that you possibly can to the functioning in your family. You have no excuse at all to allow your caregiver to do it all for you, because that's not what we want. We want you to just kind of re-identify yourself. Now you're the same wonderful human being. You just happen to have Parkinson's disease, and there's lots you can do to be beneficial and to be happy this day. So you hold on to that. You hold on to that. And you let go of what you always love to do. Maybe you got to let it go. Right? And you focus on, what can I get into today? What can I do and have fun to do it today? And don't forget that we're all maturing, we're all seniors, and there's lots of things that as we get older, we're not able to do as well as when we were 25, 35, 45. So as part of the normal aging process as well, that as we get older, we don't have as much energy, we don't have as much ability, we don't have as much stamina. So you let it go, you allow more time to do the task at hand, and you maintain that positive attitude. Well, maybe I can't do this, but I can do this, all right? And just let go of the one and focus on, what can I do today well? What can I do today that I enjoy? And what can I do today that will make me feel positive and independent about myself? So with regards to the functional limitations, the physical changes, they're going to happen. They're going to happen. You do the progression of Parkinson's along with the normal aging process, all right? And you're going to see some slowdown. You're going to see some changes. You're going to see more difficulty with what you're doing from a physical standpoint. Greatest thing you can do for yourself physically, you all know this, get out of the recliner. Get out of the recliner. You can walk. You can do exercises. You can get in the pool and do aerobics. You can do Tai Chi. You can do yoga. You can do all these wonderful things. This is why we're so proud of Parkinson Place here in Sarasota, because we have 5 different exercise classes a week that will allow you to keep yourself strong and maintained so that you continue to do as much as you possibly can. Get in and out of the chair, walk across the room safely. So you want to keep moving. You want to take a look at physical exercise through normal exercise programs that you can get at Parkinson Place and other areas, or physical therapy, outpatient physical therapy, in-home physical therapy, whatever. Whatever it takes to keep you on the highest functional level, all right? Keep your body, mind, and spirit up and moving. Get out of the recliner, take ownership in your life, and do everything this day to keep yourself strong and mobile. The other thing that's very important with looking at maybe giving up some of the things that you couldn't do before, I want to see you if you need a walker or a cane. All right, I want to see you up and out doing the things that you love to do. So if you have to rely on the wheelchair, the walker, the cane, then you do it. You do it. Anything that's going to get you up out of the bed, up out of the recliner, dress, safely mobilize through your home, in the car, out and about, so that you can say, okay, maybe I can't do everything as well as I could do before as regards to physically, but I'm doing everything in my power to stay strong, to maintain my balance and my safety and my dexterity. So whereas you have a functional loss, okay, fine, but with the right state of mind, the empowerment, the motivation to do something about it, that's how you can focus on what can I do today. I can't do this, but I can do this. I can exercise, I can walk, I can get in a pool, I can ambulate, I can get out and about. So you have a problem, but you've got a solution. Continue to do absolutely as much as possible as you can for yourself, and I want you to rely on your caregiver only when absolutely necessary. So we've talked about some physical losses that you have with Parkinson's disease. You had a few losses, but you can replace them with things that you are able to do today. You might find yourself doing things today that you never even thought you liked doing, and you never would have had the opportunity if you didn't have the time and the inclination to find something new. So investigate that and find out, what am I good at, what do I enjoy, and get on out there and do it. So physical loss, you're going to feel some. Emotional loss, it can affect you emotionally. It can affect you emotionally. This is a difficult disease. Its challenges are great. And you carry a burden, don't you? You carry a burden getting through the day with Parkinson's disease. It'll put you absolutely on an emotional roller coaster, the highs and the lows. I can't even say to you, how you doing today? I have to say to you, how you doing this minute? How are you feeling emotionally? How do you feel about yourself? What is your stress level? Are you feeling empowered? Are you feeling positive? Now, with all the many challenges that you live with 24/7 with Parkinson's disease, many times the emotions that you are feeling are not the positive ones. Nobody ever says to me, I feel happy. You know, I'm tickled pink that I have Parkinson's disease. You never hear that. You hear things like, I'm frustrated, I'm upset, I'm frightened, I'm fearful. You know, all of the negative feelings come into place when you're dealing with the emotions of Parkinson's disease. They're negative. This is tough. This is a difficult disease. Its side effects, its challenges on you are huge. But you know what I've taught you before? You can only think one thought at a time, and you can choose the thought. And no matter what you're thinking, no matter how thin you slice it, everything is able to be flipped over. So if you're dealing with the negativity, the negative emotions associated with Parkinson's disease, and there are many, I want you to flip it over. I want you to flip it over to, what can I do today, and what am I grateful for today, and what makes this day special for me. Do not get overcome with the negative emotions. Do not get overcome with thinking about how this disease has changed my life, has changed my ability to live my life, or how it has changed me physically, my appearance, my ability, or anything else. You focus on the fact that today you will be positive. That positive attitude will carry you. It will carry you. Your thinking will carry you. It will empower you. It will motivate you to absolutely make the most of this day. So if you're feeling negative, if you're feeling down, if you're feeling less than your best, a lot of times folks will say to me, you know, it really has affected, I've lost my sense of self, or I've lost my confidence in myself. Don't let that ever happen to you. This is just Parkinson's disease. And this disease has absolutely no ability to change the wonderful person that you are. It can't change the great gifts that you have inside. It can't change all the many qualities that make you extraordinary, that make you loved by the people in your life, your family and your friends and the people that know you. This disease has a lot of power. It does not have the potential to change you. So I don't want you to feel, oh, I've lost my self-confidence, I've lost my sense of self. You're only going to lose these things if you allow Parkinson's disease to take it from you. It does not have the ability unless you allow it. So you might not look exactly like you did before you had the disease, but you look just great today, right? You might not think that you're as confident or as capable as you were before, but you are. You are if you can work the way that you think, if you can work the fact, I will be positive, I will be powerful, I will be motivated, and I will not allow this disease to impact my positive thinking or my positive sense of self. Right? You need to be confident, you need to be up and out, you need to maintain your sense of self, your love of self, your self-worth cannot be stripped of you because of the Parkinson's disease. You are still a valuable, precious human being. You need to realize what makes me worthy and what can I do this day to make the world a better place, because that's the only reason that any of us are really here. So you might have lost some emotional strength, you might have lost some esteem, you might have lost some confidence, but only you can get it back, and only you can maintain it and grow it every single day. And that stems from how you think, all right? Nothing that you have can be taken away from you unless you allow the disease to do it. So I want you to maintain that positive image, that positive sense of self, that positive attitude, right? That positive sense of control, because all of these things you own. And everything that you need to meet and greet all the challenges of Parkinson's disease are inside of you. Most often they're hiding out in your toes, aren't they? Sometimes you wonder, how am I going to do this one more day? But you will, all right? So you are today exactly as you should be, and only you can stand tall and be empowered and say to yourself, emotionally I am strong. Emotionally I am strong, and I can and I will do this for my sake and for the sake of everybody in my life that knows and loves me. So now we've talked about the physical changes, the physical losses. We've talked about the emotions, all right, the sense of self, the esteem, the confidence. Now we can talk about the mental. This can many times affect us mentally. You know, when we were kids, we could remember everything. We didn't have to write anything down. And now, even with the normal aging process, you maybe can't remember as well as you could when you were younger. You can't, what we call, multitask, do 6 things at the same time. You can't juggle 6 balls in the air at one time. Well, that's okay. That's okay. Sometimes with Parkinson's disease, there are some mental and there are some cognitive changes. And this isn't true of everybody, but it is true of some. Please always remember that there are never 2 Parkinson patients the same. You are unique, you are special. We can have 2 men the same age be diagnosed on the same day, be given the same medications and the same treatment plan, and a week, a month, a year later see 2 different men or 2 different ladies. So realize that you are unique, and whereas it's important that you know and understand everything that you can about Parkinson's disease, you cannot cookie cut it, and you cannot assume that because I have the disease, this is what's going to happen to me. All right? You might have one, some, all of the symptoms. Some might be worse than others. Some might be a greater challenge than others. It doesn't matter. All you need to do is to stay focused in the minute and deal with what you are dealing with right now, this minute. Now, memory loss, many times, for some Parkinson patients, not always, everybody, they do experience mild, moderate, sometimes even severe memory loss. All right? You can't remember. This is usually short-term memory loss. You can tell me what you did in kindergarten way back when, but you might have trouble reminding yourself, what did I have for breakfast? Did I have eggs or oatmeal? All right? It's usually the short-term memory loss. And you deal with that step by step along the way, you and your caregiver, you and your loved one. If you're dealing with memory loss, if you're noticing short little changes, you need to take that immediately to your doctor, because we can't see memory loss. We can't see all of a sudden, I can't remember where are the car keys, or I can't remember my telephone number. So if you're realizing any little subtle changes with your memory and your recall, what do I want you to do? I want you to call your neurologist. Call your neurologist. And just simply say, I'm noting some changes in my ability to remember. And then you go to your neurologist with your caregiver and you talk about the subtle changes that are affecting you. Now, most often, the first person that'll notice subtle memory changes is the caregiver, because that's the person that is living with you hour after hour, day by day, and they might be able to notice some little subtle changes in your memory and your recall, sometimes even a little bit of confusion and difficulty getting through a task or things like that. I want you to talk openly with your caregiver. I want you to be open and honest about if these issues are happening to you. I want you to go to your physician and explain what's happening with your memory and have an evaluation. There are medications that are very appropriate that might help you with the memory loss and sometimes the cognition issues as well. So once again, you have a problem, but you have a solution. And just like everything else I'm talking about today, you are the keeper of your life. This is your life, and nobody's going to fight for your life more than you. You have a loving caregiver and loving family and loving friends and colleagues and physicians and a healthcare team that love you and want the best for you. But nobody's going to fight for your life harder than you. So it's very, very important that you wrap your head around the fact that you accept your Parkinson diagnosis and that you're going to do everything in your power, reaching out to the resources available in your life, to hold on to your life and to make it as wonderful and as beneficial today as it possibly can be. And one key, the main key for that, is to give up what you lost and to focus on, here's the great person that I am today, and here is my problem, and here is my solution. And I have the belief that everything that I need to meet and greet my Parkinson's disease is inside of me, and I can do this. And I'm going to pull it up, and I'm going to use it, and I'm going to be a partner with my caregiver and with my healthcare team to have the best life possible today. You need to be tolerant to the changes. Tolerant, accepting, patient. Patience is a very difficult thing. You all know that with Parkinson's disease, you're a little slower, right? It's okay to be slow. It's okay to be slow. It's okay to take twice as long to do a task, as long as you do it. As long as you do it. As long as you maintain as much control over your life as you can possibly muster. That's the key. So physical changes, emotional changes, mental changes, and the last one that I like to talk about that I've learned that is so important for Parkinson patients. It's why we are so proud of Parkinson Place and the constant opportunities that we give for socialization, the opportunity for folks to get out of their home, to get up and to get dressed and to get out and about and to be with other people living day by day with Parkinson's disease, not only for the patient, but for the caregiver, right? So social changes happen. Lots of times, unfortunately, I have had a lot of families tell me, we were running with this couple for so long, and now because of certain changes in our life, we don't quite fit in with this or with that or whatever. It doesn't matter. You get up and you get out anyway. You find social activities, you find venues, you find things within your community that you can do so that you're up and out of the house. If you stay belly up in the recliner, it'll lead to apathy, and apathy will lead to depression. You may not stay in the home isolated. You may not feel that because you might have certain physical side effects to the disease, or that you have some apparent symptoms that the public might notice. That is absolutely no excuse. You get up, you get dressed, you find a way to get yourself to something going on within your community. Now, at Parkinson Place, we have the great opportunity for coffee in the morning, the activity, the group participation, the opportunity for you to be with others, just like you. But there are also many, many opportunities within the community to be up and out and to be supporting your social activities. You have no excuse to stay home. No excuse to stay home. You need to go to church, you need to go to temple, you need to go to dinner, you need to go to the arts, you need to go to the theater, you need to do all the things that you love to do. Maybe you've never done them before, but now you have the opportunity to get out and to do this. I find that the world is a very kind place, and you will find that almost every restaurant, every theater, everything. I know Sarasota is dedicated to this, as is in every city, in America, that it's all user-friendly for folks that have physical limitations. There's ramps, there's grab bars, there's whatever. So your need to be out and to be social is critical. If your group of friends changes, then you find a new group of friends and you get out and you be stimulated and you be empowered and lifted up by nice things that you can do within your community with the people that you love to do things with. It's all about quality of life. Quality of life, everybody thinks quality of life is to be disease-free and to be up and able, and it's not. Quality of life, at least through my eyes, is nothing more than the ability to do the things you love to do with the people that you love to do them with. And I've noted with every decade of my life, those activities have changed, and if I've had to modify what I'm able to do as I've moved forward into my senior years, and that's just great. So I think it's almost been fun to replace this, what I used to do, with this, that gee whiz, I never had the time or the opportunity to do it, and I'm having so much fun realizing new, fun, and appropriate ways to fill up my time and to enjoy my life. So you can have quality of life at any stage. Quality of life, is all about you. And you need to focus on the fact that it takes more than just a pulse to be alive. And if you're a wonderful human being striving to live every day well with Parkinson's disease, then you have the full possibility to make this day absolutely extraordinary, because you have choices to make. I can't do this, but I can do this. And this is what it's all about: the empowerment, the motivation, the holding on to your life as you have it today. I encourage you to focus on the moment. Don't live in the past. Don't go back there and say, well, if this wouldn't happen, this today would be different. It's gone. And what you have today is this precious day. And if you're living in the past, or if you're forecasting into the future, you're losing this moment, this beautiful day that you can fill up with fun activities, nice things to do, and most of all, with good people in your life. Good people in your life that you have this day to share it with, and you should be very grateful for that. I know that that's one thing I always focus on every day. Today's a brand new day, and I'm going to be excited about it, and I'm going to fill it up with really good people and really good things. And you see, that state of mind Parkinson's disease cannot touch, nor can anything else in life. Now, my wonderful caregivers, we all know that caring for a loved one with Parkinson's disease can create what I call the challenge of a lifetime. The challenge of a lifetime. You have not chosen to be a caregiver. You didn't stand in line and say, pick me, I want to be a caregiver. But you are stepping forward, hand in hand, step by step, helping your loved one to make this day wonderful and positive and a good day. So everything that I've talked about with the ability to live in the moment and to give up the past, to accept and tolerate the changes, goes for you as well. Please remember that patients and caregivers are partners. You work together. To enjoy this day and to maintain what I call the positive patient-caregiver relationship. You're partners together. One pushes, one pulls. You both are liable for the other to help and to support and to appreciate and to motivate the other so that they can be the best that they can be today, that they can maintain that positive attitude and that joy for this moment. So you caregivers, it's your role not only to help your loved one to give up what they have lost and to hold on to what they have, but it's your need as well. So this is something you can talk about together, you can work on together so that you can move happily into tomorrow and to the day after that. All right? Your role, my caregivers, is to maintain the esteem and the dignity of your loved one. Your role is to help them to be physically, mentally, emotionally, and socially on their highest possible level, because you love them, you want them to be the best that they can be, but that being said, the happier and the higher level functionally and emotionally and mentally and socially that your loved one is, the easier it becomes on you and the better your life will be. So my recommendation is, like I said before, to take an assessment of life today. Where am I today? How am I thinking? What's my state of positivity? What's my state of stress? We all know that stress is huge. Stress is huge with any disease, with any limitations in life. It's large with seniors. It's large with anybody that's carrying a heavy challenge physically and emotionally. So stress is in there with this, and stress has the ability, to really impact your ability to maintain that positive attitude and that sense of control. So I want you to be real careful managing your stress. And if you're noticing it's stressful for you because you can't get yourself into the day, you can't get yourself into the moment, you're stressing about what you can't do, you're stressing about your limitations, I want you to work yourself through that. And if you're not able to do that, you and your caregiver, or you coming to some of the programs that we have here at Parkinson Place, then that's another red flag that you want to go and talk to your neurologist about your level of stress. But I guarantee you, if you can, what I call, be happy in your skin of who you are today, if you can wrap your head around, I have Parkinson's disease. Parkinson's disease does not have me. And that's the message that I've been teaching for 15 years. This is your mindset. I have Parkinson's. Parkinson's does not have me. This is your empowerment. This is your motivation. This is your ability to be the best that you can be today. And that is all that you can ever ask of yourself. Your only responsibility is to be the best that you can be. You don't have to live up to anybody else's expectations. You don't have to be what you think you should be at this moment in time. Your only responsibility is to be the very best that you can be. And if you strive to be compliant with the medical management that your neurologist has put into place, that if you're doing your best, to take your medicines on time and do your physical therapy when that's been indicated, that you're doing your best to get up and to get out and to get involved with exercise classes and educational programs and Q&As, lunch and learns with physicians, and you come to social activities and things like that. You're doing your best with that as well. If you're doing your best to be your best today, that's all that anybody can ask of you. That's all that you can ask of yourself. And I think it's very important at any age that you look in the mirror and love what you see. What do you see when you look in the mirror? I don't want you to see the Parkinson's disease. I don't want you to see any changes that might have occurred physically in you, or emotionally in you, or mentally in you. I want you to see the great person that you are today. It doesn't matter who you were in the past. It doesn't matter who you're going to be in the future. The only thing that matters is the great human being that you are today, whether you're a Parkinson patient or whether you're a loved one caring for someone that you dedicate your life to with regards to helping them day by day. So you look in the mirror and you look at yourself and you say, I'm just the same, I'm terrific, I can do this, I'm living well with Parkinson's disease, I'm going to enjoy this day, and I'm going to enjoy tomorrow. Okay? It's all about how you think. You can control your thinking. You can only think one thought at a time, and you can choose the thought. So be tolerant, be accepting, be understanding of the influence that Parkinson's disease has had on your life, physically, mentally, emotionally, and socially. But be assured that with the right mindset, with the right positive thinking, with your ability to reach out for your resources and the people in your life that love you and are going to help you, that your life today can be absolutely extraordinary. So let it go. Focus on who you are today. Stand up to it. Be strong. Love yourself. Enjoy today and move forward into tomorrow. This is your Parkinson power. The power that you need is inside of you. So pull it off from your toes and use it.